Nursing MCQ Part 5. First question. World Heart Day observed on. Options are 21st September, 10th October, 28th September, 14th August. Answer is 21st September. Next question. Non-invasive method of oxygen saturation monitoring can be done by. Options are arterial blood gas studies, venoclysis, capillary blood gas studies, pulse oximetry. Non-invasive method of oxygen. It is done by pulse oximetry. Next question. Automatic rhythmic contractility is the characteristics of cardiac tissue, connective tissue, nervous tissue, epithelial tissue. Automatic rhythmic contractility, it is the characteristics of cardiac tissue. Next question. Drug of choice for respiratory depression in a newborn whose mother received morphine during labor. Options are naloxone, lidocaine, digoxin, adrenaline. The morphine antidote is naloxone. Next question. A normal local tissue responds to radiation. Options are atrophy of the skin, redness of the surface tissue, scattered pustules formation, sloughing of 2 layers of skin. The answer is redness of surface of tissue. The local response of the radiation is redness of the tissue. Next question. Immunization against DPT should be administered via oral route, subcutaneous route, intramuscular route, intradermal route. DPT is administered by intramuscular route, that is 0.5 ml. It will be given in 6, 10 and 14 weeks. Next question. Which of the following manifestation indicate that client with cirrhosis is developing hepatic encephalopathy? Options are change in vital signs, change in respiratory status, altered level of consciousness, decreased urine output. In case of hepatic encephalopathy, there will be increased level of ammonia. So, there will be altered level of consciousness. So, the answer is altered level of consciousness. Which of the following is a typical signs of tracheoesophageal, it's a sign, okay, typical sign of tracheoesophageal fistula? Continuous drooling, slow response to stimuli, diaphragmatic breathing, passage of frothy meconium. In esophageal fistula, there will be connection between the organs, internal organs. So, the food will not be passed into the stomach. So, there will be continuous drooling. The answer is continuous drooling. Next question. World No Tobacco Day is observed on 5th June, 10th August, 31st May and 7th April. The answer is 31st May. Best method of oxygen administration in a 2-month-old baby. Options are oxygen hood, nasal cannula, oxygen mask, nasal sprong. Answer is oxygen hood. Which of the following test result is useful to assess the liver function? Options are glucose tolerance test, serum transaminase, creatinine clearance test, serum electrolytes. The answer is serum transaminase, or the liver function test is the useful result that will help to identify the liver function. Next question. Absence of ganglion cells in colon is a feature of ulcerative colitis, anorectal malformation, Hirschsprung's disease, Ray's syndrome. Absence of ganglion cells that can be seen in Hirschsprung's disease. Next question. Patients with upper abdominal surgery are advised to use an incentive spirometer during the post-operative period in order to stimulate circulation, prepare for ambulation, strengthen abdominal muscles, increase respiratory effectiveness. Answer is increase respiratory effectiveness. A 4-year-old child is having a weight of 7.8 kg. To which grade of protein energy malnutrition does this child belong? Grade 1, grade 2, grade 3, grade 4. The malnutrition can be assessed, or the weight of the child can be assessed by different formula: best guess formula, APLS formula, Veach formula, simple method, etc. So here the child is 4-year-old and the approximate weight for this child is 20. So when we are assessing the percentage, it will be below 50. So the grade will be 4. Which of the following is the best technique to determine whether a nasogastric tube is positioned in the stomach? Irrigating with normal saline, aspirating with syringe for gastric contents, placing free end of the tube in water, installing air and auscultating over epigastric area. The answer is aspirating with syringe for gastric contents. Next question, gastric lavage is contraindicated after ingestion of which of the following? Options are aspirin, corrosive alkali, furudan or dalam. The answer is corrosive alkali. Next question, which of the following would be the best indication that fluid replacement for the client in hypovolemic shock is adequate? Skin feels warm, diastolic BP above 90 mm of Hg, systolic BP above 100 mm of Hg, urine output greater than 30 ml per hour. Answer is urine output greater than 30 ml per hour. In an underwater seal drainage system of fluid fluctuation in the drainage tubes generally means that lung has fully expanded, lung has collapsed, mediastinal space has decreased, chest tube is in the pleural space. Answer is lung has collapsed. What is the compression ventilation ratio for 2 rescuer CPR? 4:2, 5:2, 5:1, 50:2. The answer is 15:2. Which of the following is a complication associated with the presence of tracheostomy tube? Pneumothorax, decreased cardiac output, respiratory distress syndrome, damage to laryngeal nerve. Answer is respiratory distress syndrome. Thank you.